Do you often feel tired even after a full night's sleep? It's possible you could have sleep apnea. Sleep apnea is a common but serious condition that affects millions of people worldwide. It's a sleep disorder where your breathing repeatedly stops and starts while you sleep. This isn't just a minor inconvenience. It can leave you feeling unrefreshed, even after a full night's rest, and can impact your daily life and overall health. There are two main types of sleep apnea. The first is obstructive sleep apnea, which is more common and occurs when the muscles in your throat relax and block your airway during sleep. The second is central sleep apnea, which is a less common type and happens when your brain fails to send the right signals to your breathing muscles. It's crucial to understand that sleep apnea is more than just a disturbance to your slumber. If left untreated, it can lead to other health complications. These include high blood pressure, heart problems, and difficulties with concentration and mood. It's more than just about getting a good night's sleep. It's about maintaining your overall health. In this video, we'll delve deeper into the symptoms, causes, and treatments of sleep apnea. We'll explore the risk factors, including obesity and smoking, and we'll look at the different ways you can manage and even overcome this sleep disorder. We'll also discuss lifestyle adjustments that can help improve your sleep quality and, in turn, your quality of life. Whether you've been diagnosed with sleep apnea or you're just curious about this common sleep disorder, this video is for you. It's time to wake up to the realities of sleep apnea. Stay tuned to learn more about this sleep disorder that could be affecting your daily life. So, what are the signs that you might have sleep apnea? Let's delve into the symptoms of this sleep disorder. Sleep apnea is a bit of a sneaky condition. It occurs during sleep, so it might be hard for you to notice the signs. But here's what to look out for. One of the most common symptoms is loud snoring. Now, it's important to remember that not everyone who snores has sleep apnea, and not everyone with sleep apnea snores. Snoring can be a sign of many things, including just a rough day. However, when it comes to sleep apnea, the snoring is usually pretty loud and is often followed by periods of silence when you're not breathing. That silence is then broken by a loud snort or gasp as breathing resumes. It's a bit of a symphony, and not the kind you'd want a ticket to. Another symptom to watch for is excessive daytime fatigue. This isn't just feeling a little sleepy after lunch. We're talking about persistent drowsiness, a lack of energy, or even falling asleep during the day. With sleep apnea, your sleep cycle is constantly being interrupted, preventing you from getting the restful sleep your body needs. This can leave you feeling like you're running on empty, even after what you thought was a full night's sleep. Then there's the repeated pauses in breathing while you're asleep. This is a hallmark sign of sleep apnea, but unless you have a bed partner who tells you about it, or if you record yourself sleeping, it can be difficult to know if this is happening. Other symptoms might include waking up with a dry mouth or a sore throat, morning headaches, difficulty concentrating during the day, and experiencing mood changes such as depression or irritability. Sleep apnea can also lead to nocturia, a condition where you have to get up multiple times in the night to urinate. And let's not forget about the restless or fitful sleep, which might involve tossing and turning, or waking up at night feeling short of breath. Did you know that sleep apnea can also affect children? In kids, signs can include bedwetting, choking or drooling during sleep, and performing poorly in school. It's essential to keep in mind that having one or even a few of these symptoms doesn't necessarily mean you have sleep apnea. Many of these signs are associated with other conditions, or even just the stresses of modern life. But if you're experiencing several of these symptoms, especially loud snoring, excessive daytime fatigue, and observed episodes of stopped breathing during sleep, these might be signs of sleep apnea. If you recognize any of these symptoms in yourself, it might be time to consult a healthcare provider. Now that we know the symptoms, what causes sleep apnea? Sleep apnea, as we know, is a sleep disorder that occurs when a person's breathing is interrupted during sleep. But what causes these interruptions? The answer lies in the two main types of sleep apnea: obstructive sleep apnea and central sleep apnea. Let's start with the most common type, obstructive sleep apnea. This occurs when the muscles in the back of your throat relax. These muscles support the soft palate, the triangular piece of tissue hanging from the soft palate, the tonsils, the side walls of the throat, and the tongue. When these muscles relax, your airway narrows or closes as you breathe in, and you can't get an adequate breath in. This may lower the level of oxygen in your blood. Your brain senses this inability to breathe and briefly rouses you from sleep so you can reopen your airway. This awakening is usually so brief that you don't remember it. On the other hand, central sleep apnea is a less common type of sleep apnea that occurs when your brain fails to transmit signals to your breathing muscles. This means you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Now, it's crucial to understand that certain factors can increase your risk of experiencing these types of sleep apnea. Firstly, obesity is a leading risk factor. Excess weight significantly increases the likelihood of airway obstruction, and fat deposits around the upper airway can obstruct the breathing. Secondly, smoking can increase the amount of inflammation and fluid retention in the upper airway, which can cause or worsen sleep apnea. Lastly, a family history of sleep apnea can also increase your risk. If you have family members with sleep apnea, you may be more likely to develop the disorder. It's important to remember that these are just risk factors, and not everyone who has these will develop sleep apnea. But being aware of these factors can help in early detection and treatment. Understanding the causes can help us manage and treat this condition more effectively. By identifying what may be contributing to sleep apnea, we can take steps to reduce these factors and improve our quality of sleep. In the end, it's all about understanding our bodies and taking care of our health. Sleep apnea might sound daunting, but there are treatments available. Let's dive into the different ways that sleep apnea is managed, starting with lifestyle changes. Firstly, a healthy lifestyle can make a big difference. Regular physical exercise and a balanced diet can help to maintain a healthy weight, which is crucial in managing sleep apnea. Smoking and alcohol consumption, both of which can exacerbate the condition, should be avoided. Secondly, positional therapy can be beneficial for some individuals. This involves altering sleeping positions to improve breathing. For instance, avoiding sleeping on your back can help prevent the throat muscles from blocking the airway. Now, let's move on to medical devices. For moderate to severe sleep apnea, doctors often recommend continuous positive airway pressure, or CPAP. This device delivers air pressure through a mask while you sleep, keeping your upper airway passages open and preventing sleep apnea. It's important to note, however, that while CPAP is highly effective, it may take some time to get used to. Another device used in treatment is an oral appliance designed to keep your throat open. These appliances, which resemble mouth guards, help to advance the position of your jaw, tongue, and soft palate to keep your air passage open. There's also the option of adaptive servo ventilation, or ASV. This device learns your normal breathing pattern and stores the information. When you're asleep, the machine uses pressure to normalize your breathing pattern and prevent pauses in your breathing. For those struggling with the use of devices, or if their sleep apnea is severe or resistant to treatment, there are various surgical options. These include tissue removal, tissue shrinkage, jaw repositioning, implants, nerve stimulation, and even creating a new air passage via a procedure known as tracheostomy. Your doctor will guide you on the most suitable option depending on your specific condition. It's essential to remember that treatment for sleep apnea is not a one-size-fits-all, and what works for one person might not work for another. Therefore, it's important to work closely with your healthcare provider to find a treatment plan that suits your needs. Also, it's worth noting that treating sleep apnea is not just about managing symptoms. It's about improving your overall quality of life. Successful treatment can eliminate excessive daytime fatigue, improve your concentration, and reduce your risk of serious health complications such as heart problems and high blood pressure. With proper treatment, sleep apnea can be managed, and you can get back to enjoying a good night's sleep. Now that we've covered the basics of sleep apnea, it's time to take action. It's essential to realize that sleep apnea isn't just about interrupted sleep or loud snoring. It's a serious health condition that can lead to complications like high blood pressure, heart problems, and difficulties with concentration and mood. If you find yourself or a loved one experiencing symptoms such as excessive daytime fatigue, loud snoring, or repeated pauses in breathing during sleep, it's important to consult a healthcare provider. Remember, the first step towards managing and treating sleep apnea is getting a proper diagnosis. We've also discussed various risk factors, including obesity, smoking, and family history. Being aware of these can help in early identification and prevention. Moreover, if you're already diagnosed with sleep apnea, remember that it's not the end of the world. Various treatment options can manage your symptoms and significantly reduce the risk of complications. It's crucial to share this knowledge. You never know who might be silently battling sleep apnea. Sharing this video might just prompt them to seek help and start on the road to recovery. After all, knowledge is power. The more we know, the better we can take care of ourselves and our loved ones. If you or someone you know is suffering from sleep apnea, remember, you're not alone. There's a vast community of people out there who are in the same boat, and there's always hope and help available. So let's start a conversation. Please leave a comment below if you have any questions or if you'd like to share your experiences. Your story might just be the encouragement someone else needs. And finally, if you found this video helpful, please give it a like and consider subscribing for more health-related content. Share this video with your family and friends, especially those you feel could benefit from this information. Sleep well, everyone.